Earlier this year, efforts to completely contain the novel coronavirus failed, meaning on the 11th of March the World Health Organization declared the outbreak a global pandemic. They said they were deeply concerned by the alarming levels of inaction taken by world leaders.
Well, thank you very much.
Ever since the epidemic, widely believed to have originated in Wuhan, China, became a pandemic, governments around the world have been desperately trying to flatten the curve. It's a phrase you've probably heard, but what does it mean? Simply put, the curve is the projected number of people who will contract the virus over a period of time. The curve takes on different shapes depending on infection rates. After an initial outbreak, a steep curve like this one means, as the curve rapidly rises, more strain is being put on the health system. Most recently, we saw this in Italy, where confirmed cases doubled from 10,000 to 20,000 in just 4 days. It was a dark chapter in global efforts to fight the virus, which saw hospitals filled to capacity and record high mortality rates. However, acting fast enough with preventative measures like social distancing and countrywide lockdowns means you can prolong the peak, thus flattening the curve, meaning more sick people can be effectively treated. As global figures continue to rise, we are seeing similar patterns emerge around the world, with one exception: Germany. So how has this country in Europe avoided the catastrophic levels of infection that have ravaged the likes of Italy and Spain? Well, one expert says the country has been on high alert since January and had more time to prepare, adding that Germany has learnt from other countries' responses to the virus by stocking up on test kits and respirators. It means the country has even had capacity to take in a number of critically ill Italian patients, with 6 arriving earlier this week. Another theory is the demography of those infected, spreading amongst a younger demographic. According to Germany's leading agency for disease control, the average age of those testing positive for coronavirus is 47. Compare that to Italy, where the mortality rate is an unprecedented 9%. The average age of cases there is 63. So what does this all mean? Has Germany managed to flatten the curve? Well, for now, possibly. In addition, the country also has one of the most robust public health systems in the world, spending more per capita on healthcare than any other leading European country. Their approach demonstrates early preventative measures do result in fewer casualties. But medical professionals caution that it is too early to say how infection and mortality rates may shift in the coming weeks.